In the latest update by the Health Ministry today on the Mandarin Orchard COVID-19 cases, the serological tests of 8 more staff have come back positive, indicating likely past infections. Now this in addition to the 3 announced yesterday. Investigations of these 11 cases are in progress.
MOH said that it has completed, quote, special testing operations on all individuals serving SHN as well as staff of the hotel. Of all those who served SHN, 3 tested positive yesterday. The ministry said it's likely these 3 are imported cases and not linked to 13 others being investigated.
Now let's recap the sequence of events. Last Saturday, December the 19th, MOH said it was investigating 13 people. They've been classified as imported cases when they were confirmed to have COVID-19 last month and had served their SHN at Mandarin Orchard Hotel. The 13 cases had served their SHN between October 22nd and November 11th and were confirmed to have COVID-19 between November 2nd and 11th.
It was found that they had been infected by coronavirus strains that have, quote, high genetic similarity, this implying that the infections may have come from the same source, and despite the fact that they had flown in from 10 different countries like the US, South Korea, Britain, the Philippines and Bahrain. MOH said they might have been infected after arriving here.
People outside these 13 cases also serving SHN at the hotel were swabbed, and that was when 3 of them were detected to be positive for the virus. They were immediately taken to hospital via ambulance.
Well, separately, the hotel stopped accepting new guests since Saturday and all existing guests checked out by 9 p.m. last night. Those serving SHN at the hotel were transported via dedicated vehicles to alternative dedicated facilities. The hotel is closed for deep cleaning and disinfecting and will remain closed as investigations are ongoing.
Earlier this afternoon, before MOH's latest update, we spoke to infectious diseases physician from the Rophi Clinic, Dr. Ling Li Min.
So other experts have pointed to human factors and hotel-based transmission as possible reasons how this could have happened. What's your take on how the guests and staff got infected?
So for the 13 SHN guests who were tested positive over the period of 22nd of November to 22nd of October to 11th November, they, as you know, based on whole genomic sequencing and phylogenetic analysis, showed that they had fairly highly of similar genetic strains. Certainly, local transmission within Singapore would have to be excluded, and that's not just purely looking at the hotel. We need to look at all the touch points, including the time that they disembarked from the airplanes, through the airport, onto the transport, and into the hotel, and including the hotel itself. As for the 3 staff who was serology positive but swab negative, they were likely to have gotten infected anywhere, I guess, between at least in the past 1 to 3 weeks. As to whether or not they form part of the cluster of the 13 SHN cases, it is very hard to tell because they are only serology positive. They could have gotten infected way before the 13 SHNs arrived in Singapore. And then finally, the 3 guests who recently tested positive, they are likely to be imported cases.
The 13 cases served their SHN from end October to mid-November, yet this was just reported over the past weekend. It's been over a month. Why is there a delay between these 13 people contracting the virus and finding a link among them?
I think it's really because it requires a lot of detailed investigative work or detective work. And a lot of it really depends on the platform that's been used to do this detective work. And I believe they are using the WGS whole genomic sequencing platform as well as phylogenetic analysis. So I guess, as in the press releases, they have already said that first, the process that's required is that they need it to culture the virus. And we all know that to culture viruses, it does take up to 4 weeks. And then after that, that's when they start working on the genomic sequencing. Therefore, I think if you think about it, it is not surprising that from the time that the last of the positive 13 cases was tested, and that's 11th of November, to the time that the announcement was made, we are looking at about this 4 to 5 week time frame.
I see. Well, Dr. Ling, is there a risk of a cluster forming from this incident, and will it spark another wave of infections in the community?
Well, I think if a cluster was going to happen, we would have already seen it. It's been 5 weeks, 4 to 5 weeks, since the last of that 13 tested positive. That was on the 11th of November. So I think if that cluster was going to happen, we should have already seen it, and we haven't. So I don't think that there has been a new cluster within Singapore that has arisen from those 13 SHNs.
Right. Now, following this incident, we know all those serving SHN were tested, staff as well. But other guests, like people on staycations, were told to check out and monitor their health. Should these guests, you reckon, still get tested on their own?
Well, I think that most hotels who are allowed to have both SHNs and people who are on staycations would have to go through a very, very rigorous process of certifying and ensuring that all their protocols and guidelines are in place and for compliance, right? So I think that would therefore mean that the probability of staycation guests mixing with SHN people are almost remote, in fact, zilch. But I think if a staycation guest was worried about themselves having the remote possibility of being infected, and for their ease of mind, if they really feel like to make themselves feel better, they would prefer to have a COVID swab. I think they can do it out of their own, for their own reassurance. But really, I think the chances of them being in contact with any of those SHN guests would have been really remote. Okay, and I think that just monitoring their own health, taking temperature, would be sufficient.
Doc, as a follow-up, how about these regular guests being in contact with the staff working at Mandarin Orchard, who may be in contact with the 3 cases of staff being reported to have testing positive for COVID-19?
Yeah, but I think that's the problem, isn't it? Is that we don't really know which staycation guests came into contact with which staff that was tested positive. But remember, the 3 staff, we don't even know when they got infected. Was it in the past 5 weeks, or was it in the past 2 months, or was it 3 months ago? Serology positivity can remain positive up to anywhere between 3 to 6 months. So I can only say that what we can do is that we can only work and advise based on what's definite. And what's definite is that SHN guests and staycation guests, usually based on the hotel protocols, would not be intermingling. I think the staff also, the staff who are taking care of SHNs versus the staff taking care of regular staycation guests, I am sure the hotels would have made provisions not to have risk of intermingling or transmission. So if we trust that we have all the protocols in place, and if people adhere to them and there aren't any breaches, then really I think the staycation guests should be safe.
Right. Dr. Ling, on a separate topic, England is reporting a highly contagious new variant of the coronavirus. What does that mean for us in Singapore? Do we need to be worried?
Well, I think this is a really interesting area, and certainly a space that we must continue to observe and watch. It remains to be seen, and there's certainly no clear-cut evidence what this new strain would mean for all of us. Is it going to be more deadly? Is it going to be more contagious? And what about the impact on the vaccine? Certainly areas that we worry about, but up till now, really there isn't sufficient data to suggest what its true impact will be. And so we really do have to watch this space. In the meantime, we have to continue doing what we are already good at, that is safe distancing measures, hand hygiene, masking, and for those who want to go for the vaccine, to go for the vaccine.
Well, thank you so much for setting aside time to speak with us, Dr. Ling. We've been speaking to Dr. Ling Li Min, an infectious diseases physician from the Rophi Clinic.
Visit straitstimes.com to follow the developing story on the cases at Mandarin Orchard Hotel.